How's everybody doing? I'm down here in Dallas today. I wanted to make a video and speak to some of you about this situation with kidney disease. I'm not sure how many other drivers are dealing with that, but I'm pretty sure there's a few out there that are dealing with it. I've started the process of getting all the medical things done that I need. I have some more appointments coming up next week, and I have started last month getting things in order. You got to do a lot of things in order for them to put you on the transplant list, from dental to psych eval, making sure that you don't have any kind of cancer, anything like that. You got to go through a whole bunch of steps to get you on the transplant list. So I've already started with mine. I do some more next week, and I got some more. I told them to schedule my stuff out 2 weeks apart so that I can work in between, get things done that way. And I gotta go and see a dialysis person next week. They say it takes a little bit of time to get you to find the right donor. If you got to go outside for a donor, it takes a minute to get you find your donor if you're not a match with anybody that you know personally. So just got to go through that process. I mean, I feel fine. Right now my kidney levels is at 17%. So it's dropping. I've changed my diet. They took me off a lot of things that I love to eat. Steak, spaghetti with meatballs. I can't do the red sauce like that. A lot of fruit that I love, oranges, the melons, anything with potassium in it. Potatoes, which I love, fries, mashed potatoes, baked potatoes. I love stuff like that. But I can't eat it, even though sometimes I do grab a small order of fries. And I've cut back on all my dark sodas. I was doing the ginger ales, but this week I even cut back on those. I've been drinking juice and water. Just trying to do as much as I can to, slow this situation down. They said I can have some red meat, I just can't have a lot of it. I can't be eating red meat every day. So I had to seriously cut back on that. And it's hard when you try to cut back on all the things that you grew up loving to eat. But it's like taking a toll on you. So I seriously had to cut back on those things. What else? Like I said, I feel fine. I don't really get tired like that. I bought me some compression socks because I had noticed when I would finish driving my shift, my legs and feet were swelling. So I bought me some compression socks to help with the circulation and keep down the swelling. I did that. I have me a little cooler right here beside me in between the chairs to keep drinks in, and I also have a fridge back there that I keep my food in. I just got finished eating a Caesar salad, so trying to include more salads in my diet, and my weight is fluctuating up and down. It'll go from 216, I think it's down to 210 right now. It might go back up to 212 or something like that, but it's been fluctuating back and forth. I need to do some exercises because I'm getting a little Santa Claus belly. And I see that my cheeks are getting bigger. So I want to at least drop about 20 pounds. That would make me very happy if I could lose at least 20 pounds. My weight's been holding pretty steady. You know, I've been around this weight for over 10 years now. When I was in the military, I stayed around 140, and then when I got out, that's when I started to gain weight. But anybody that's out there, if you have high blood pressure, keep an eye on your high blood pressure. My high blood pressure is the reason why I have the problems with my kidneys. My kidneys control your blood pressure, and if your blood pressure is out of whack, then it puts a lot of strain on your kidneys. So keep an eye on that. I was taking the lisinopril, and I think the lisinopril is what was causing my kidney function to go down, because after they took me off the lisinopril, my numbers started to level out. So I've been on a lisinopril for probably about a good 20 years. And lisinopril is not, even though it controls your blood pressure, is not the best thing for your body because it does damage in other ways. So, I mean, it's a catch-22 situation. You know, it offers some good things, and then on the other hand, it offers some bad things. Like you see on the commercials, they'll tell you one good thing that the drug does, and in quick, low voice, they'll tell you 50 things that it does to harm you. So, I don't know. You can't win for losing. You know, just do your best you can. I see a lot of drivers out here, their legs are swelled and discolored. I don't know if they are seeing a doctor, but when you go to a truck stop or at a shipper or whatever, and you see a driver standing there and their legs are seriously discolored from swelling, they got some serious medical problems going on. And you can't take this stuff as a joke. I mean, I don't want to be out here and have a medical issue, especially if I'm going down the highway. You know, I take my baby aspirin to keep my blood thin, and you know, I take my blood pressure medicine because I'm not trying to stroke out behind this wheel. You know, I want to stay. You know, if I don't feel right, or if I'm driving down the highway and start to feel funny, then I'm going to pull over. You know, and go lay down, and hopefully it goes away. If it doesn't go away, then I'm going to call somebody. Be like, hey, this is what's going on with me. You might need to send somebody. You know. But sometimes you can get sick pretty quickly before you have a chance to do anything about it. So I try to stay on top of stuff like that. But that's what I wanted to talk to everyone about. Your health. Keep yourself as healthy as possible. You know, this job can be hard on you. So just do what you can. Try to make good choices when you're eating. I know they don't always have the best things for you to eat out here on the highway. And but try to stop at Walmart, grab you some healthy stuff to eat instead of buying stuff that they have at the truck stops. I'm seriously trying to cut back on the fried food. I cut back on the chicken. I've been buying some fish. You all know that it can be very, very expensive eating out here on the highway. You can spend a couple $100s a week just in food alone. So it's just a lot. But do what you have to do to keep yourself healthy, and I'll see you on the next video. Thanks.